To another video. So today we discuss about what are complications of this insomnia. Insomnia. When insomnia is severe, the last long time, it causes sleep deprivation. A major concern with sleep deprivation, daytime sleepiness, which can be dangerous if you drive or doing other tasks that require you be alert. Attentive sleep deprivation can also increase the risk of certain conditions. Depression, anxiety, high blood sugar, heart rate, stroke, obesity, sleep apnea. Type 2 diabetes is a obesity condition that involves psychosis. The healthcare provider can diagnose insomnia, use the combination of methods, especially by asking your question about your health history, personal circumstance, sleep habits, systems, and more. They may also recommend certain tests to roll out. Other conditions that could cause to contribute insomnia. There are not any tests that can diagnose insomnia directly. Instead, tests help rule out other conditions with similar symptoms to insomnia. The most likely tests include sleep apnea testing involving an overnight sleep study and sleep lab. At home sleep apnea screening device. On the other tests also provide depending on your symptoms. And the other factor your healthcare provider is the best person to tell you what test they recommend. There are many ways to treat insomnia, ranging for simple changes in your lifestyle and habitat of varied medication. These mean approaches to treat insomnia. Developing and practicing good sleep habitat, also known as sleep hygiene. Medication that help you fall asleep, stay asleep, forming and might otherwise. Medication, many different types of medication can help you fall, stay asleep. When these are sedative and hypoperative drugs, most prescription and non-prescription as well. As mental health medications are certain herbs and supplements. Stated drugs, these can get in the name of Latin word. That means to settle their reduced nervous system activity. Hypoponic drugs, these get their name of Hyphon and Greek god of sleep. This make you sleep. In general, healthcare provider is the best person to help about the possible treatment. At which they recommend for you, they are also best source of information about the possible side effect of complication and treatment. The following information certain example of medication, but it lists every treatment available. Remember, the medication of treatments for may not help everyone. Some medication can interact with others at your age of physical health. Play role 2. It is important to keep in mind that while medication can help you sleep, some may also negatively affect your sleep cycle. Sleep quality, not just quantity, is important. That means you should use medication. Even more, the counter was continuously. Prescription, several prescription drugs types can treat insomnia. Depending on your location, some medication might have legal restriction because of how they work their effect. Benzoid examples include the expert of the group these benzoids, despite their name, because they have similar properties. The most common of these include insomnia, dual experience, receptor antagonist. Oroxan is way promoting chemical in your brain. Blocking soin help you sleep. Example these. Sedating and depressed. These include typical antidepressant. Drugs like melatonin in a chemical your brain use tell that it's time to go sleep. It can come to prevent also synthetic drugs that work similar medicine. Do not take more than recommended amount of melatonin without first checking your healthcare provider. With drug allergies can also make you sleepy. Example of this include diaphragm, addictive ingredient drug like benadryl and drugs are commonly used. Many herbs and supplements can help treat insomnia. While many of these are common and well known, the best not to assume that a herb or supplement is automatically safe for you. You should talk another healthcare provider about herbs and supplements. Before taking them, things avoid possible side effects. For interaction, especially their medical conditions and other medicines, Mental health care providers can greatly affect the quality of sleep.